Hello and welcome to my channel. This lecture will continue our talk about the thigh, the femoral triangle, and the adductor canal. So let's begin. The femoral sheath is a funnel-shaped sheath, anterior wall formed by the continuation of the fascia transversalis of the abdomen. Posterior wall is by the fascia iliaca that covers the iliacus muscle, and it encloses the femoral artery and the femoral vein. Now, please pay attention to this because the femoral nerve is not included in the femoral sheath, unlike what happens in the axilla, where the vessels and nerves are together in one sheath, the axillary sheath. Here, the nerve is outside the femoral sheath. Now, the lateral wall of the sheath is pierced by the femoral branch of the genitofemoral nerve, or you can say the roof of the anterior layer of the sheath is pierced by the femoral branch of genitofemoral nerve, and the medial wall is pierced, like you see here, by the great saphenous vein. And it has three compartments. Look at this here. The nerve, we learned that it's outside the sheath, so we are dealing with this area. This is the medial compartment, which is the femoral canal, and bounded superiorly by the femoral ring. The femoral ring is bounded anteriorly by the inguinal ligament, posteriorly by the pectineus and pecten of pubis, medially by the cruciate edge of the lacunar ligament, and laterally by the femoral vein. Okay, this is important because this is the entrance to the femoral canal. The femoral canal here, this is a site for femoral hernia. The hernia is directed downwards, not towards the scrotum like the inguinal hernia, and continues down to a limit and then may go up again to the lateral side because of the end of the femoral sheath. This is the femoral hernia and the site for the femoral hernia. So remember the compartments. The medial compartment has the deep inguinal lymph nodes in it and connective tissue. It allows for the expansion of the femoral vein, which is in the intermediate compartment, and the femoral artery in the lateral compartment of the femoral sheath. Okay, let's proceed. The femoral triangle, laterally bounded by the medial border of sartorius muscle. See? Medially bounded, and this differs in books. Some books, consider the adductor longus belongs to the triangle, so the medial boundary is the medial border of adductor longus. Some books do not consider the adductor longus part of the triangle, so they designate the medial border as the lateral border of adductor longus. But it makes sense to count the medial border of adductor longus as the medial border for the femoral triangle. The base is formed by the inguinal ligament, and it makes a depression under the inguinal ligament. Okay, it has a gutter-shaped floor, as you can see here, that sinks in the middle. It's formed by the iliacus and the psoas and the pectineus and the adductor longus muscles. This is the floor of the femoral triangle. Femoral vessels pass from the mid-base to the apex, as you can see here, from the mid-base to the apex. The adductor canal, on the other hand, is the continuation or begins at the apex of the femoral triangle. It's this area. Bounded, the lateral wall is the vastus medialis, and pay attention to that. The lateral wall is the vastus medialis. The medial wall is the sartorius, or the anteromedial wall is the sartorius, and is the roof for the canal. That's why the other name for the adductor canal is the subsartorial canal. And contains the femoral vessels, the nerve to vastus medialis, and as you can see here, the saphenous nerve medial to the nerve to vastus medialis, descending genicular artery or vessels from the femoral artery, and the subsartorial plexus of nerves formed by the intermediate and medial cutaneous nerves of the thigh, together with branches with the obturator nerve. This is the subsartorial canal. This is the subsartorial plexus in the adductor canal. Now, it begins at the apex of the femoral triangle but ends at the aperture in the adductor magnus as the femoral artery leaves the ventral aspect of the thigh and goes to the dorsum as the popliteal artery. The femoral artery is a continuation of the external iliac artery from the mid-inguinal point, and courses anteromedially in femoral triangle, pass through the adductor canal to become the popliteal artery by passing through the aperture in the adductor magnus or the adductor opening. The proximal part is enclosed in the lateral compartment of the femoral sheath, and proximally it lies on the psoas tendon, separating it from the hip joint. Anteriorly, you will find the skin, fascia, superficial inguinal lymph nodes, fascia lata of the thigh, femoral sheath, superficial circumflex iliac vein crosses the artery, and femoral branch of genitofemoral nerve, superficial to or anterior to the artery. The femoral vein is medial in the upper thigh, then posterior in the lower thigh, then posterolateral at the adductor opening. Okay, so as the popliteal vein will be posterolateral to the popliteal artery. The saphenous nerve crosses the femoral artery from lateral to medial, so crosses it superficially as it goes down to supply the medial side till the middle of the medial side of leg and the medial side, medial side of leg and the medial side of toe, of the big toe. This is the saphenous nerve. The surface anatomy of the femoral artery is a proximal 2/3 of a line from the mid-inguinal point to the adductor tubercle. So this represents the course of the femoral artery. Because you need to know this, because in certain procedure, like asking the patient to abduct, flex and lateral rotate his thigh to expose the femoral artery to obtain arterial blood gases sample. When you obtain arterial blood gas, you obtain it from the femoral artery, or when you want to introduce a catheter in the heart to visualize the coronaries, for example, you pass through the femoral vein, then the external iliac vein, then the common iliac, and so forth, till you reach the heart. The branches of the femoral artery has superficial branches. It has a superficial circumflex iliac to the anterior superior iliac spine anastomosis. It has superficial epigastric on the lower abdomen, and superficial and deep external pudendals, not internal pudendals. They supply the spermatic cord and the medial part of thigh, and the genitals, the superficial and deep external pudendal arteries. These are the superficial branches of the femoral artery. The deep branches is the profunda femoris artery, or the deep artery of the thigh. It arises from the lateral surface of the femoral artery. I was asked this before as a multiple choice question. From the lateral aspect of the artery, and then sends its branches as perforators around the femur and ends as the fourth perforator. It crosses behind the femur and pierces the lateral intermuscular septum and the branches, the perforators, and end in the vastus lateralis. Anyway, but the branches of the profunda femoris artery, the medial circumflex femoral, the one you see here, but as long as it originates, it disappears. It goes backwards. First passing between the psoas and pectineus muscles, then between the adductor brevis and obturator externus muscles, then between the quadratus femoris and adductor magnus muscles, where it divides into into ascending and transverse branches. The ascending branch with the tendon of obturator externus and the transverse branch to the cruciate anastomosis. The lateral circumflex femoral, on the other hand, the one you see here, passes deep to the rectus femoris and sartorius and passes through the branches of the femoral nerve, dividing the branches of the femoral nerve into superficial and deep groups, and gives branches, ascending branch with the intertrochanteric line to anterior superior iliac spine anastomosis, transverse branch to the cruciate anastomosis at the level of the lesser trochanter, and a descending branch that along the anterior border of vastus lateralis with its nerve, and gives a branch to the knee at the end. These are the ascending, transverse, and descending branches, while the medial circumflex femoral has only ascending and transverse branches. The perforators, there are four perforators, curve around the femur as you learned before, and pierces the lateral intermuscular septum and end by supplying the vastus lateralis. The fourth being the continuation of the profunda femoris artery. The first is above the adductor brevis muscle and gives a branch to the cruciate anastomosis. The second perforator through the adductor brevis muscle gives a nutrient to femur. The third is below adductor brevis muscle, and the fourth and the last is the continuation of the profunda femoris artery, as you can see here. Okay? Another deep branch of the femoral artery is the descending genicular branch, the one you see here that shares in the anastomosis around the knee joint, the descending genicular branch. It arises in the subsartorial canal, in the adductor canal, and descends to supply the knee. Now for another artery, the obturator artery, it arises from the internal iliac anterior division, as you can see here, with the nerve above it and the vein below it, and it goes through the obturator canal at the superior border of the obturator internus muscle and fascia, and then emerges behind the obturator externus, where it divides into anterior and posterior branches. Now, the obturator artery, this is the typical course from the internal iliac and through the obturator canal. It may stop at supplying the obturator internus, and the continuation of the obturator artery is replaced by the anastomosis between the pubic branch of obturator and the pubic branch of inferior epigastric artery. As you can see here, the anastomosis replaces the obturator artery between the inferior epigastric and the obturator. In this case, the obturator ends by supplying the obturator internus and fascia, and the continuation of the obturator outside the pelvis is by the continuation of the anastomosis between inferior epigastric pubic branch and obturator pubic branch. Other branches of obturator inside pelvis, it gives iliac and pubic branches and vesical branches. Outside pelvis, it divides into anterior and posterior branches, deep to the obturator externus. And from the posterior branch, a branch to the acetabulum through the acetabular notch to supply the hip joint. This is an important supply for the hip joint. Okay, it's between the obturator externus and the obturator membrane. The veins accompany the arteries, correspond to the arteries. So this is the obturator artery. Now, trochanteric anastomosis at the level of the greater trochanteric fossa, formed by superior gluteal, medial and lateral circumflex femoral arteries, and inferior gluteal. Now, the cruciate anastomosis at the level of the lesser trochanter, pay attention to this, is formed like above by the medial and lateral circumflex femoral, by the inferior gluteal, not the superior gluteal, but by also the first perforator artery. Anterior superior iliac spine anastomosis, just inferior to the anterior superior iliac spine, and it's formed by the superficial and deep circumflex iliacs, the superior gluteal artery, the ascending branch of lateral circumflex femoral artery. Now, why we are concerned about these anastomosis? Because these are the sites together with the connection with the obturator artery and the external pudendal arteries. These are side channels to fill the femoral vein if it's obstructed or occluded, distally. If you occluded the proximal to the profunda femoris artery, the thigh still fills through the anastomosis, okay? And if you obstructed distal to the profunda femoris artery, the thigh is saved, will not suffer from diminished blood supply, but the distal part of the limb still will be the affected part. Okay, so connections between the obturator artery and the medial circumflex femoral, between the internal pudendal artery with the superficial and deep external pudendals, deep circumflex iliac arteries with superficial circumflex iliac, and inferior gluteal artery with perforating branches of profunda femoris artery at cruciate anastomosis. Inferior gluteal artery. Okay, so this is an important question in the case of occlusion. Of course, there's no sudden occlusion, but it's gradual occlusion. That's why it gives time for the collateral connections through the anastomosis to develop. The great saphenous vein, the veins start from the dorsal venous arch of the foot. At the medial side, it extends to form the great saphenous vein, ascends anterior to the medial malleolus and posterior to the medial part of tibia, and hand breadth posterior to the medial border of knee, then enters the thigh and drains in the saphenous opening, 2.5 centimeters below and lateral to the pubic tubercle. The tributaries of the great saphenous vein, of course, the plexus of veins of the lower limb, but sometimes the plexus forms an anterolateral column and posteromedial columns in the thigh to drain in the vein. Now, the vein has valves all over its course, and affected with varicose veins in patients when the column of blood cannot be carried by the valves inside this long vein, the longest vein in the body. So the varicose veins on the sides of the leg. If varicosity happened at the entrance to the femoral vein, this is called the saphena varix, which is a varicosity at the entrance of the great saphenous vein to the femoral vein. You drain the venous drainage, you drain the venous blood from the patient's limb, elevated limb, you drain it, and then you occlude the saphena varix and ask the patient to put his limb down again and see if there is filling of the vein of not, is in spite that you are occluding the opening with your thumb. So this is to test for the saphenous varix or not, present or not at the saphenous opening. This is the great saphenous vein. Okay. This is another, plate to show you the superficial branches. The branches corresponding to the superficial branches of the femoral artery drain into the great saphenous vein before it drains into the femoral vein. Okay. The superficial inguinal lymph nodes, it's a group of lymph nodes that you can divide into a T-shaped manner, like lateral limb and medial limb and inferior or vertical limb of or group of superficial inguinal lymph nodes. The lateral limb drains the gluteal region and lower abdomen. The medial limb drains the genitalia and lower abdomen and medial thigh. The lower group or vertical group drains all the lower limb to it, the vertical group. Now, the deep inguinal lymph nodes are present in the femoral canal, and they drain the genitalia, especially the glans penis and or glans clitoris, and drain it into the external iliac lymph nodes. So remember the deep inguinal lymph nodes, they're called deep inguinal lymph nodes of Kluke. Okay, so this is about the lymphatics. This is another plate to show you the lymphatics of the lower limb. See lateral limb, medial limb, and inferior vertical limb of the superficial inguinal lymph nodes. Nerves. We have the femoral branch of genitofemoral nerve that pierces the sheath, the femoral sheath, remember, and supplies the roof of the femoral triangle, the skin of the roof over the femoral triangle. The lateral femoral cutaneous nerve descends medial to the anterior superior iliac spine under the inguinal ligament, or pierces the inguinal ligament. It divides into anterior and posterior branches that supplies the lateral thigh. The posterior branch also supplies the gluteal region. Remember that, the lateral femoral cutaneous nerve, or the lateral cutaneous nerve of thigh. The femoral nerve, on the other hand, from the L2, 3, 4 dorsal divisions, it descends between the psoas major and iliacus muscles, descends in branches, by the way, not as one piece, one cord, in its branches. In the abdomen, it gives the iliacus and pectineus, remember that. And the lateral circumflex femoral artery, as you can see here, divides the branches into superficial and deep groups, or anterior and posterior groups. The anterior group gives the intermediate femoral cutaneous nerve, supplies the front of thigh, and branches to patellar plexus here around the patella, and it's a cutaneous nerve. The same like the medial femoral cutaneous nerve, which is also a branch of the anterior group, and crosses artery from lateral to medial to supply lower medial thigh, and shares also in the patellar plexus and the subsartorial plexus, and the nerve to sartorius to supply the sartorius, as you can see here. This is from the anterior group or superficial group. From the posterior group, the saphenous nerve, the one you see here, this is the saphenous nerve that passes through the subsartorial canal and emerges here to supply the medial of the leg and the medial of the big toe, the saphenous nerve. Muscular branches to the quadriceps femoris muscle, to vastus lateralis, to vastus medialis, vastus intermedius, articularis genu muscle. This is for the supply of the quadriceps, or the muscular branches of the femoral nerve, and also vascular branches that originated in the sympathetic system to supply the femoral vessels with sympathetic supply. Okay, The obturator nerve, L2, 3, 4 ventral divisions. It enters of the obturator foramen and divides into anterior and posterior branches behind the obturator externus muscle. The anterior branch passes above the obturator externus muscle behind pectineus and supplies hip and adductor muscles except for the adductor magnus, and also shares in the adductor plexus or the subsartorial plexus. The posterior branch of the obturator nerve pass through the obturator externus and supplies it, and it's behind the adductor brevis and supplies adductor magnus. Sends also an articular branch to the knee with the popliteal artery. The accessory obturator nerve, L3-4 ventral divisions, it arises descends, supplying the surrounding adductor muscles, and ends by joining the anterior branch of the obturator nerve. Well, this concludes our talk about the femoral triangle and the adductor canal with the related vessels. I hope you got the maximum benefit from this lecture, and thank you very much for watching.